Loss of intimacy is one of the biggest red flags on the way to great divorce, the growing phenomenon among couples in long-term marriages. While many factors contribute to a lack of desire, for menopausal women often it's simply to avoid painful sex, something we don't often want to talk about. We will today on Second Act TV. Dr. Laurie, thank you for staying and continuing this conversation. This is not a real pleasant one, so let's try to come up with some pleasant outcomes. Let's put it this way: painful sex, something that I experienced. It can end a marriage. What happens to us as we age?
Well, first, before we get into that, I know there's a ton of women out there that think they're abnormal. They don't want to talk about it. Mm-hmm. So I want you guys to know this is normal. Yeah. This is actually more common than not having the problem. So first of all, normal. Second of all, please, 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 open the line of communication with your spouse, because a lot of them, yeah, but men don't get it. Most men are very loving. They love their wives or their partners. They want them to enjoy sex. They really do. Mm-hmm. And, when you're in pain, they don't like it. So educate that it's not them. Mm-hmm. That this is a physiologic problem, and there are things that they can do to make it better. Mm-hmm.
Yeah. What can they do to make it better? That's a tough subject for me. I was never able to address that. I still might have issues with that. How do you counsel women?
Well, basically, number one, if you can't talk to your partner about sex, then I highly suggest a professional counselor to really work on communication, because the core of any relationship is communication. Yeah. Because you could balance hormones, you could have all the natural stuff, you could have all the mood right, but if the communication's not there, the vagina will clamp down, won't let anything in, okay? So number one, really seek professional help if there's communication issues. I find just opening up in a non-threatening way, talking to your partner and saying, hey, I've been going through changes, you may be going through some too, but these are the changes that I'm having, and explain that, hey, my vaginal area is a little more dry, more irritated. Explain to them that as we age, you get a little hormonal imbalance there, and if you think of your vaginal tissue like a sponge, it goes from this nice moist sponge that's very comfortable to a really dry sponge that when there's sex, it's almost like sandpaper in there, and it really hurts. Even if you're desiring, even if you love them, even if you're in the mood, if it's not right down there, it can hurt, and then that decreases the mood.
Yeah, yeah. We've heard a lot about lubricants. How do you feel about that?
I find they sting, they hurt people, so you want to restore the vaginal mucosa, obviously. I find natural stuff works well. First of all, it's the foreplay, getting the natural juices that are there flowing, so talking, this is the communication, have some fun, pick up some coconut oil, start massaging each other, start with the feet, move up, I love the feet, and truly get it going naturally, and you can actually put that in the vaginal area. You can put it on the guy and really have fun with it and make it a communication thing, make it enjoyable, and this is all natural, and it doesn't sting, it doesn't hurt.
Yeah. Yeah. That might be so out of context for somebody in a long-term marriage to all of a sudden change like that. What kind of experience do you have with that with your patients?
You know what? Some of them definitely have cobwebs in their vaginal area, and they have really gotten to the point where they're not touching. So, and that's not good. Marriages can't last, and it should be enjoyable. So the first thing is get them used to just simple touching each other's hand, hugging. You get them used to some physical contact, and then just start somewhere. And again, that's where the counselor can help a lot. But
and if you're willing, then if there's a will, there's a way.
Exactly.
Yeah.
Exactly.
So as long as everything else is okay and your marriage is intact, there's could be some easy solutions. Of course, for me, the hormone, the testosterone balancing was huge.
Oh, it's a huge piece, and what people need to understand is it's a piece of the puzzle. Hormone balancing is huge, but also the first thing is open the line of communication, talk to your partner. If you need help with that, get somebody to help you. Number two, get some natural fun stuff like coconut oil. There's lots of good natural stuff.
That works.
And it does work. And then start doing fun touching and just start getting into that direction.
Yeah. So to sum up, we're normal. Right. I know I didn't feel normal. So that was really good to hear that I'm, not the only one out there. And talk. and have your hormones checked. Is that what you?
Yeah, and use some natural stuff, you know, natural fun play, natural, there's so many natural oils out there to use, and touching each other, and just, yeah, it's everything.
Okay. Thank you, Dr. Laurie. That was, you put a nice bow tie on a painful subject. Till next time.